Hi guys, Dr. Maggio here, episode 9 of Ask the Doc. Nicole asked me a great question yesterday. Nicole's the owner of SPSC Crossfit here in St. Petersburg, Florida. She said, why do people automatically default to going to a PT when they have an injury? So the first problem is here, people end up going to their primary care physician when they're having pain or some type of injury. And we talked about in earlier videos, primary care physicians just aren't equipped to be able to handle musculoskeletal injuries. They just don't get the training in school and it's not in their scope. So they automatically just refer you out for physical therapy, and mostly because it is covered by insurance, so it's easy access to get some treatment. We've been ingrained with this whole idea that if you're injured, you're just going to try PT. I hate the premise of just using the word try. At the end of the day, it has to be the right treatment for your problem. Often physical therapists, chiros, orthos, acupuncturists diagnose based off what they're trained in instead of what you actually need. They tried to mold the diagnosis to fit their skill set instead of what the problem truly needs. So if you are having pain and dysfunction and you go to a PT and all they're doing is some exercises, some stretches, ice, heat, laser, stim, it's not going to get to the root cause of your problem or get you a full resolution of your injury. You need someone who can also get in there and manually address the soft tissue dysfunction. When we talk about soft tissue dysfunction, I bring it up all the time, but it needs to be said again. Adhesion is the number one cause for decreased flexibility, pain, and weakness. It's often underdiagnosed and it doesn't show up on X-ray or MRI, but you have to fix the soft tissue manually, and no amount of stretches or exercises are going to fix that if there's a problem in place. So you really need to get the tissue cleaned up first. And if your PT isn't doing that and jumping further ahead to strengthening and stretching, it's not right in the order of operations of fixing the problem. So I'm not here bashing physical therapists or anything like that. There is a need for physical therapy. I just think it gets overprescribed and underdelivers when you're really having a problem. So who should go to physical therapy? Definitely post-surgical people. When you get in there and they cut you open, there's all sorts of dysfunction and you kind of need to relearn some motor patterns to work around that dysfunctional tissue that had been fixed. The other one is just in the normal order of operations. The first step is you restore normal range. That's where a good manual therapist comes in, breaks that tissue down, gets normal functioning back to the muscle. But if there's a glaring weakness in there or some really bad motor patterns that are going to cause that problem to come back, physical therapy is a great part for that, doing some corrective type of mechanism to make sure that the neural pattern is functioning correctly to keep that soft tissue dysfunction from coming back. Thanks for the question, Nicole, and we'll see you guys next week.